Dura matter comprises of the outer endosteal layer and the inner meningeal layer. The blood vessels, the meningeal blood vessels can be seen in the outer endosteal layer of the dura mater. The meningeal layer sends in folds of dura mater. The big one is seen and is the falx cerebri. A smaller fold is the falx cerebelli. A big fold which separates the cerebrum above from the cerebellum below is this big tentorium cerebelli. And anterior-most part is a small fold which is known as the diaphragma cellae. The sinuses in relation to the dura mater, which are lying between the outer endosteal and the inner meningeal layer of dura mater, are the superior sagittal sinus, which is lying in relation to the falx cerebri, the inferior sagittal sinus, which lies in relation to the free margin of the falx cerebri. The inferior sagittal sinus joins with the great cerebral vein to form a sinus which is known as the straight sinus. The superior sagittal sinus usually continues as the right transverse sinus and right sigmoid sinus. The straight sinus continues as the left transverse sinus and the left sigmoid sinus, which continue as the internal jugular vein. The other important sinuses are the cavernous sinuses. The cavernous sinuses are lying one on each side of the sella turcica in relation to the middle cranial fossa. In the sella turcica, is the hypophyseal fossa, where lies the very important endocrine gland which is known as the hypophysis cerebri. In relation to the hypophysis cerebri is the fold which is already mentioned, and this fold is known as the diaphragma cellae.